Before prescribing and inserting Implanon NXT, you should always thoroughly counsel the woman on the risks and benefit of the implant. The first step is to remove the sterile preloaded disposable applicator from its blister, keeping the needle and the implant sterile. If contamination occurs at any stage, it's important that a new sterile applicator be used. The woman should lie on her back with her non-dominant arm turned outwards and bent at the elbow. To minimise the risk of neural or vascular damage, Implanon NXT should be inserted at the inner side of the non-dominant upper arm, about 8 to 10 centimetres above the medial epicondyle of the humerus. It's recommended that you make 2 marks, one at the insertion site and a second one 6 to 8 centimetres above the insertion site, which can be used as a direction guide. Clean the insertion site with a disinfectant. Anaesthetise with approximately 2 ml of 1% xylocaine, applied just under the skin along the insertion canal over a length of about 4 centimetres. Look into the tip of the needle to check for the presence of the white-coloured implant. It's important that you don't touch the purple slider until you've fully inserted the needle, as this will retract the needle and actually release the implant from its applicator. Next, stretch the skin around the insertion site with your thumb and index finger, and with the tip of the needle angled at less than 30 degrees, puncture the skin. Make sure that you can see the insertion site and the movement of the needle during the entire insertion procedure. Once you've punctured the skin, lower the applicator to the horizontal position, and while lifting the skin, gently insert the needle to its full length. The needle should be inserted parallel to the skin to ensure that the implant is inserted superficially and not too deeply into the muscle. Make sure that the needle is inserted to its full length. If this is not done, then the implant may protrude from the insertion site and potentially fall out. While holding the applicator still, unlock the purple slider by pushing it slightly down. Then keep moving the slider right to the back of the applicator in order to retract the needle and to lock it inside of the body of the applicator. It's very important that you do not move the applicator while you're moving the slider back, as this too may result in protrusion of the implant through the skin. Once the implant is in its final subdermal position, remove the applicator. It's important to try and confirm the presence of the implant by palpation just after the insertion procedure. A correctly placed implant should be palpable by the clinician as well as by the woman. You should be able to feel both ends between the thumb and finger. If you cannot feel the implant or you doubt its presence, a non-hormonal method of contraception must be used until the presence of the implant can be confirmed. Apply steri-strips and a sterile dressing, and it is recommended that a pressure bandage be placed over the top to prevent any bruising. The woman can remove the pressure bandage after 24 hours, but the small bandage over the insertion site is best left there for 3 to 5 days. The applicator is for single use only and must be disposed of in a biohazard sharps container.